My name's Annmarie Bosco, and I am a haematologist here at the Prince of Wales Hospital. So, haematology has a very broad range of clinical applications, and we look after patients who have hematological cancers, but all the way to chronic blood conditions like sickle cell disease and thalassemia. So, in our body, we all have red blood cells that circulate around. And in a normal hemoglobin, the red blood cells are flexible and they're able to pass through all our little capillaries without breaking up. And in sickle cell patients, they have a genetic change that makes the red cells not flexible. So they can't pass through small blood vessels and they form these little clots. And unfortunately, that causes what we call microischemia, so lack of blood supply to various organs and chronic pain. So these patients present with pain episodes, they present with, they can have strokes and heart attacks, lung clots and things like that because of the red blood cells blocking blood vessels. So it's a lifelong condition and can be really challenging for these patients. So if we think about the red blood cells being the problem, then there's two main treatment pathways. First of all, is treating them when they come in with a pain crisis and getting the treatment set up for that. So pain relief, antibiotics, fluids, etc. But then it's trying to treat the underlying cause. Most people, we try and give them a drug called hydroxyurea, which is to try and boost the infantile hemoglobin F, which is meant to be the good hemoglobin for these patients. Mm-hmm. And then there are lots of new kind of treatments coming into the pipeline. Mm-hmm. So which include things like stem cell transplantation or gene therapies in the future. Mm-hmm. Okay. So firstly, it's a disease that can affect young people and impair their quality of life and long-term health problems. So people who do have sickle cell disease already need to be aware that we do have a team to look after them, and there are treatments that we can do for them, and to come in and see us if we need to. But then also in the general population, it's something that we can pick up in people who are planning to have children. So sickle cell disease is like a genetic condition, and it's a 2-gene problem. So you inherit one gene from your mum, one from your dad, and then you have sickle disease. It runs in certain ethnicities more than others, and we can test mum and dad even before they have children to know if they're at risk. So I think those kind of things are important for people to be aware of. As I mentioned, the gene therapies and transplantation treatments, people are looking into these all the time to see whether they can actually change the genetic makeup of the red blood cells, stem cells. But then there are also new drugs to try and alter the shape of the red cells and to prevent them from what we call sickling. So fortunately, people are doing research in this area, which is great. This is maybe one of the reasons why I chose hematology, was because looking after a sickle cell patient who was really young and had come in with a pain crisis. And I remember thinking, gosh, this young man is really suffering. And then he was treated according to the sickle cell pathway with pain relief, fluids, etc. And 2 days later, I walked in and he was smiling and he was really much better. And I thought, wow, isn't that amazing? Like, we can do stuff to improve the quality of life of people in this area. I was a junior doctor. I looked after him, and so that memory has stayed with me all along.